Vulnerable populations presentations, our group decided to do veterans. This was done by Brianna Everett, Arturo Llanas, Sheila Gerardo, and Christine Tirado.
Veterans have been seen to have poor health outcomes, increased risk for chronic conditions, health-related quality of life that is ranked lower, and a higher utilization of healthcare overall. Veterans are also seen to have significant mental health concerns such as depression, post-traumatic stress disorder, PTSD, and anxiety. Veterans who have PTSD are associated with having higher rates of depression and increased risk for alcohol use disorder, as well as being at an increased risk for physical disease, somatic complaints, pain, and impaired functioning.
Why are veterans considered vulnerable? Due to a mixture of physical, mental, and social health adversities, the veteran population can be deemed as vulnerable. They may face long-term challenges from combat injury, post-traumatic stress, and transition into civilian living. In addition, veterans are also at increased risk of housing and food insecurities, making them more likely to experience vulnerability. It is often difficult to transition back to civilian living after active duty. Because of this difficulty, adjustment leads to vulnerability with outcomes such as poor health and social instability.
What are contributing factors? Contributor factors include combat and service-related trauma. So, due to the exposure to violence, high stress environments, and traumatic events during duty, it increases risk for PTSD, anxiety, depression, and substance use disorders. Another risk would be the transition into the civilian life. Many veterans have a difficult time transitioning back into civilian society, reporting feelings of social isolation, loss of identity, lack of routine, and difficulty finding meaningful employment um, are some of the common reports. Limited access to healthcare. So this could include geographic barriers. So where people are living, they have difficult access to healthcare. Problems with insurance. Long time waits at VA facilities that make it difficult for them to get appropriate care. Another one would be stigma and mental health. The stigma that surrounds seeking help for psychological problems discourages many people from seeking help. So, this is another risk. And minority and gender identity challenges. So, many people who identify as Black, Hispanic, or LGBT, and even females also face additional barriers. Statistics. PTSD prevalence. Nearly 11 to 20% of veterans who served in operations Iraqi Freedom and Enduring Freedom experienced PTSD in a given year. And for Vietnam veterans, this would be 30% that have experienced PTSD in their lifetime. Mental health and substance use. Veterans are at higher risk for depression and substance use disorders, especially alcohol abuse. About 1 in 3 veterans seeking VA care have a diagnosed mental health condition. Racial and ethnic health gaps. According to Ward, Black and Hispanic veterans experience higher rates of circulatory, musculoskeletal, and infectious diseases compared to white veterans. Black veterans are also more likely to report poorer self-rated health. Female veterans. Women veterans report higher rates of anxiety, depression, and military sexual trauma than their male counterparts. And they're also more likely to develop PTSD after deployment. Homelessness. Veterans represent about 6% of the adult population, but account for about 8% of the homeless population. An estimated of 37,000 veterans are homeless on any given night. Disability rates. About 41% of veterans enrolled in VA healthcare have a service-connected disability rating of 50% or more. And this is a chart showing some of these statistics with clearly seeing disability as one of the biggest ones, followed by mental health diagnosis and PTSD, and lastly, homelessness. What are the health disparities for veterans? Some of the health disparities include racial and ethnic disparities, Black and Hispanic and other minority groups, and for veterans report worse self-rated health, graded VA healthcare utilization, and more combat exposure than white veterans. Black and other male veterans report more circulatory and musculoskeletal mental health and infectious disease conditions compared to white veterans. And Black and Hispanic veterans may experience misdiagnosis due to clinician bias. Also, gender disparities. Female veterans have higher similar rates of most diagnosed conditions than male veterans, including higher rates of mental health and substance use disorders. Social economic disparities. Lower socioeconomic status veterans are more likely to have poor health outcomes, including those with mental health conditions. Veterans may face economic barriers to care, including financial issues and lack of health insurance. Other disparities include rural veterans who may experience higher rates of conditions like diabetes, COPD, while urban veterans have higher rates of HIV, and hepatitis C. LGBT veterans face a disproportionate risk of suicide and other poor health outcomes due to stigma, discrimination, and barriers to
Healthcare resources for veterans. The Veterans Health Administration, or the VHA, provides different health support services on their website. These include blind rehabilitation, which is support for blind and low vision veterans and their families, caregivers and caregiving, support and services for those who care for veterans, chaplains for spiritual health needs, community living centers, which include short stay and long stay nursing home care for veterans who are medically and mentally unstable, compensated work therapy, which is vocational rehabilitation programs that endeavors to match and support work-ready veterans in competitive jobs, dental care benefits, disease prevention and health promotion, the Fisher House, which is a home away from home for families of patients receiving medical care at major military and VA medical centers, geriatrics and extended care, homeless services, mental health services, My Health eVet, which is internet access to VA healthcare information and services, the National Center for PTSD, patient-centered care, prescriptions, where veterans are able to refill their prescriptions through the online app My Health eVet, prosthetics and sensory aids, readjustment counseling, which offers services to eligible veterans and their families in an effort to aid their successful transition from military to civilian life, rural health, which improves access and quality of care for veterans living in rural areas, smoking cessation programs, substance abuse programs, telehealth, which connects health records and services to veterans and their providers, the Veterans Crisis Line, which is a toll-free confidential resource that connects veterans in crisis and their families and friends with qualified caring VA responders, weight management programs, whole health programs, and women veterans healthcare. How do veterans impact the health system? High utilization of services. Veterans use health services at a higher rate than civilians, particularly for chronic conditions like diabetes, COPD, musculoskeletal issues, and mental health care. VA hospitals serve over 9 million veterans annually. Mental health services. The need for specialized mental health care has led to expanded programs such as telemental health, PTSD clinics, and peer support models. Veterans require long-term and trauma-informed approaches. Integrated holistic care models. Veterans often require multidisciplinary care, coordinating between primary care, mental health prosthetics, rehabilitation, and social work teams. This model is increasingly being studied for application in civilian healthcare settings. Workforce and funding demands. VA facilities must continuously recruit specialized providers and secure funding to keep up with demand, especially for aging veterans and those with complex service-related injuries. Advancement of technology. The VA has led innovations in telehealth, electronic health records, or the EHR, and integrated data sharing, which have influenced broader health policy and technological development in the U.S. healthcare system. Policy influence. Laws like the PACT Act expand eligibility and benefits, which increases caseloads for providers, but also ensures necessary care for those exposed to service-related toxins.
Political concerns related to veterans. The PACT Act is a law that was established to expand benefits for veterans that were exposed to burn pits, Agent Orange, and other toxins. This act was put into effect in 2022 as legislation developed a commonality between the usage of Agent Orange during the Vietnam War and the development of hypertension. So it's expressed that Vietnam veterans are at increased risk of hypertension, and more of those veterans have hypertension as opposed to other veterans. Another political concern relative to veterans, the lack of access to quality health care. Although there are veteran affairs hospitals, which are helpful, there are many concerns among veterans leading to quality of care, long wait times, and access. Housing support is another major concern among veterans. In the year 2024, there were approximately 33,000 homeless veterans in the United States alone. To combat this, programs such as HUD, Veterans Affairs Supportive Housing, or HUD-VASH, have been established. This program is inclusive of housing vouchers along with supportive services to help veterans find and afford appropriate housing. So along with the housing vouchers, they also offer supportive services for mental health, things such as PTSD, anxiety, transitioning back into civilian living, and assistance with maintaining and affording appropriate housing and combating food insecurities.
Some of the Healthy People 2030 goals slash objectives addressing veterans are not very specific. While Healthy People 2030 does not have an included goal for veterans specifically, it focuses on the attention and progress related to appropriate preventative care, including screenings for cancer, respiratory issues, cardiovascular disease, and mental health, along with the treatment conditions affecting veterans. This means veterans that have previously served or are in service, they're exposed to a multitude of hazardous chemicals, dust, explosions, fire. Therefore, they're placed at a higher risk to have certain issues such as respiratory issues, such as always being around hazardous chemicals, a lot of dust, a lot of smoke, making it easier for them to develop any sort of respiratory issue, along with cardiovascular diseases as they are exposed to lead and other hazardous chemicals. One direct objective pertaining to veterans that I was able to find is to increase the proportion of adults with tinnitus that started in the past 5 years who have seen a specialist. A lot of veterans suffer from hearing loss or hearing damage to some extent due to the multitude of their profession. Um, they may be around a lot of explosions, loud noises, and even though they are provided ear protection, they don't always have the ability to equip such ear protection, and therefore they may suffer from a burst eardrum or hearing loss or difficulty hearing. So it's important once they return from service to be able to see a specialist in order to improve the quality of life that they may live. The target set forward by Healthy People 2030 is 74.2%. However, the baseline was 61.8, and it has since maintained at that baseline. What are ethical concerns for veterans? Some ethical concerns for veterans include access to adequate health care, meaning they may experience a denial or delay in care, and it can be seen as a failure to those who serve, especially at the Veterans Affairs hospitals. Sometimes they're overcrowded or they don't have enough room to treat veterans. So it may impose some sort of ethical dilemma because they serve their country, but they might believe that their country is not serving them back. The second one is mental health and PTSD, which is ensuring dignity and autonomy while providing appropriate support, conflicts with institutional responsibilities. An example of this would be a veteran speaking to a psychiatrist. Despite the patient provider confidentiality, that psychiatrist, because they are employed by the Veterans Affairs, is mandated to report any findings to the higher ups, which can be seen as an ethical concern because it violates the patient's autonomy and their dignity, because whatever they're speaking may have to leave that room for higher ups, which could potentially influence their employment and their ability to maintain a job. The other ethical concern is the homelessness and economic disadvantages to veterans. We explore society's moral obligation to provide housing and employment for those who have served, and it is common knowledge that majority of veterans have a higher chance of dealing with homelessness than regular personnel, and the numbers in veteran homelessness have persistently increased throughout their years. So an ethical concern would be exploring the government's responsibilities and society's responsibility to providing housing and employment opportunities for said veterans. Moral injury is another ethical concern because it questions about how institutions prepare and support soldiers in morally complex environment and how they assist with recovery afterwards. An example of this is some veterans may be placed on disability or suffer from long-term effects of being a soldier. It may be increasingly difficult to find a job, maintain a job, and even get an interview. Some institutions would rather not hire a veteran, even though it is protected by the federal government, because they would have to accommodate the veteran. An example I would give, if a veteran has been physically compromised and cannot meet certain requirements of the job, they will be denied that job simply because of what they experience being a veteran. And some institutions may not even give them a chance because they don't want to hire a veteran, they don't want to deal with providing accommodations for anybody else. And the final ethical concern is veterans' quote unquote war legacy. So society may have opinions on wars that the veterans have participated in causing bias. An example I would give of this would be the Iraq War. Some people in society have their opinions on the war. However, the veterans did not have a say. And just because they participated in said war, they may face bias, discrimination. And another example I would give would be in the Vietnam War. Once veterans came home, the general public was calling them names, harassing them, even physically assaulting them simply because they disagreed with the war. But veterans have no say in what war they go to. So this is an ethical concern because they might be overlooked for job interviews and positions or even raises in their job simply because of their involvement in a specific war.
And these are our references. Thank you.